went to my healthcare.gov to see what my premiums were going to cost. Man, I'm literally going to die. I'm roughly going to make around $19,000 next year, and my monthly premiums are $1,200. So I won't have money to get my scans done. I won't have money for meds. If I get sick again, that's going to be it.
My premium has 100% doubled. My deductible 100% doubled. Maximum out of pocket over 100% doubled for the same exact insurance. Can't afford that.
I got this in the mail today. This is from Cigna. They are my health insurance provider, telling me that my monthly premiums effective January 1st, 2026 under the Affordable Care Act are going to go from $24 a month to $1,473 a month and 3 cents. I was trying to do the math on that. That's approximately an increase of 6,100%. This is what the Democrats are fighting against.
We are in this painful month-plus government shutdown, in large part because Republicans refuse to extend subsidies to make healthcare more affordable. Healthcare.gov open enrollment started earlier this month. Millions of people are logging on and seeing their premiums for the exact same coverage more than double.
For all those people saying, oh, the tax credits, oh, this isn't going to actually be a thing, like the government shutdown should end. Well, I got a little letter today in the mail from Ambetter. My monthly payment right now is $665 for me and 2 kids for 2025. My new premium starting in January is estimated to be $1,260.89. Why this government shutdown is happening is because we're all about to be screwed out of being able to have health insurance. I mean, I can't afford that. Try not to cry. Try not to freak out. Hold the Republicans accountable until they fix this. Otherwise, me and my kids are not going to have health care.
Food stamps are cut and federal workers are not being paid, even though they have to work. And airline passengers cannot get from point A to B as we get closer and closer to Thanksgiving. And we wait for the end of the shutdown. Here is Trump's billionaire Treasury Secretary, Scott Bessent, basically dodging the question about whether they have any plan for healthcare to get us out of this mess. It seems like they're holding it about as closely as they're guarding the Epstein files. Check this out.
Premiums are going up because the cost is going up and there's no way to provide Affordable Care Act services without numbers like that. Is there a plan? Because the president has talked about a plan for a long time, and here we are.
Yeah, Joe, I'm not going to get into negotiations until the Democrats reopen the government. So, I'm not going to preview it, that reopen the government, and then the talks can...
Preview what? What is their answer to the mess that we're all in?
I just checked our healthcare coverage for 2026 because we got a notification that it would be changing due to the big, beautiful bill. And our insurance premium is 400% more than it was in 2025. 400%. That is absolutely insane. All of the co-pays also 400% higher than they were in 2025.
That's something that I've seen in so many of these videos. It's not only that the monthly premiums are skyrocketing, it's that all the related costs are. The annual deductible, the copay every time you go to see a doctor. It's all increasing. So it's not really comparing apples to apples in many cases of, oh, I've got the same coverage and now it just has increased in price. It is not the same coverage.
I found out today from the marketplace that instead of paying $650 a month for health insurance for my son and me, I'm now going to be paying with my current plan $1,151 and some cents per month. And my deductible is increasing from $1,500 to $4,000. I'm self-employed, so I don't have the option for employer health insurance, and I'm a single mother, so I don't have a spouse I can get health insurance from. This is why Democrats haven't signed the bill. This is why they're refusing to sign, because they knew that people like me were going to see our health insurance premiums double without the subsidies, the premium tax credits.
That's it. And the sticker shock is happening now, but for people who weren't really tuned in to why the government shutdown has been happening for over a month, that is it. This fight started back then, and it continues. And Democrats are standing up to these insane healthcare prices.
My husband and I are in the same boat as so many people right now. In July of 2025, our health insurance premium went from $59 a month to $798 a month. And since it is now open enrollment, I just logged in to see what, if we stay on the same plan, what our premium is going to be for 2026. $1,208 $2,091 a month. Our family deductible has gone from $0 to $11,900. Our primary care copays have doubled.
And the fact that they're both real estate agents with inconsistent income month over month probably explains the jump back in July from $59 to the 700s per month. But even then, the same insurance in the 700s to now over $1,200 and increased copays and increased deductible. The story just goes on and on.
I'm 36 years old and I'm about $3 million in medical debt. After a heart attack, open heart surgery, and life support, I was 8 weeks in the hospital. I'm a retired veteran or medically disabled veteran. And you would think they would cover it. I showed a video like this when I first got to the hospital back in November, and I showed this bill right here, totaling $500,000. And everyone said, it's not $500,000. You only owe $22,000. Your insurance paid the rest. Yes, you're correct. But what about these other hundreds of bills that I haven't even opened some of?
This is a U.S. veteran. This past year, the Consumer Financial Protection Bureau, one of its last acts was to pass a rule to keep medical debt off of people's credit reports. So yeah, you have to go bankrupt because you had a $3 million healthcare bill and you couldn't pay it. Back in the Obama years, I used to work at the CFPB. Well, during the Biden administration, they got it across the finish line.
This new rule from the Consumer Financial Protection Bureau will remove an estimated $49 billion in past medical bills on credit reports and prevent medical bills from being listed on credit reports moving forward.
Well, earlier this year, Trump and Elon Musk, when he was hanging around, gutted the Consumer Financial Protection Bureau, and lo and behold, we now get news like this.
In January, the Trump administration removed a rule that the CFPB put in place that would remove medical debt from credit reports. I have never met a Democrat or Republican that thought that removing medical debt from credit reports was a bad idea. This is about as bipartisan as it gets. Nothing says land of opportunity like telling a cancer survivor that they can't get a mortgage because they chose to get chemo. Who benefits from this? Literally the only people that benefit from this are debt collectors.
Yep. In addition to the zillion-dollar healthcare industry, the millionaires and billionaires who fund his ballroom, he has sided with debt collectors. So at the same time that we're seeing a lot of these videos with people just reacting in shock to their new insurance premiums, you are seeing more and more people say, why don't we have universal healthcare?
As a Canadian who's been living in the USA for a number of years, the healthcare here was the biggest shock to get used to. So as you know, in Canada, we have universal healthcare, and in the US, obviously, we do not.
This what y'all don't understand is that universal healthcare is such a complex issue. Out of the 33 developed nations, only 32 have been able to make it work.
Bingo. Here's someone who was really opposed to that and has come around, and some of the lessons we can learn about how more people might see why this system isn't working for us and we need something better.
One of the first cracks in my journey from super far right, ultra conservative to left adjacent was healthcare. The thought of government-sponsored universal healthcare was absolutely terrifying. And I even continued to believe this after I had 3 children on state Medicaid, mostly because that was all of the information that I was being exposed to. My conservative circles, my media sources, which at the time was pretty much exclusively Fox News, took these outlier stories from other developed nations that were really scary and then use those to paint a picture of what universal healthcare is really like everywhere. One of the things that I really appreciate about all these doctors coming onto social media now and actually filming them going through the process of appeals and peer-to-peer and the denial is that we can actually see now that all of those things about universal healthcare that we were so afraid of, the death panels, the other people making decisions, the denials, bro, we already have that. We have that plus medical bankruptcy. We have that plus paying thousands of dollars just for the pleasure of getting to have a card that says you have insurance that a lot of times you can't even use because your deductibles are so high and you have to pay like $10,000 before the insurance plan that you already pay thousands of dollars for will even cover anything. And then after all that, they can still say, no, we're denying that. And that's all legal. It's all completely legal. We have death panels. That we are in a death panel health system already. The only difference is that the purpose of our death panels is so that healthcare CEOs can buy their second yachts and vacation homes in Martha's Vineyard. And yet people are fighting so hard to keep that system. Guys, they pulled one over on us so good.
Well, it's not sustainable. More and more people across party lines and around the country are waking up to the fact that this system is not working for any of us unless we're super rich. Hopefully the Trump administration and Republicans will get the message soon enough and we can end this government shutdown. But I also hope that the Democrats are listening to what people are saying. We need something drastically different from the system that we have.